All right, so that was the Health Minister responding to that Ombuds report on the Rahima Moosa Hospital. And really, it's been confirmed that this hospital, built for healing and for saving lives, has become a hell for many pregnant women. The Health Ombudsman Malegapuru Makgoba has released those shocking findings around the hospital, saying it's filthy, it's unsafe, and patients were subject to inhumane conditions. Let's speak now to Professor Rudo Mathiva, who's a representative of the Progressive Health Forum, also head of critical care at Hani Baragwanath Hospital, and Professor Alex van den Heever, who's the WITS Social Security Systems Administration Management Studies Chair. Thank you both, professors. Let me start with you, Professor Mathiva. This really confirming what we've been reporting on, what was highlighted way back, and the Progressive Health Forum agreeing with it all. You've been sounding the alarm on conditions at Rahima Moosa for a long time, haven't you?
So, correction, I am representing the I Am movement that immediately came out after Dr. De Meyer blew the whistle publicly on what was happening at Rahima Moosa Mother and Child Hospital.
All right.
I just want to
thank you.
Yeah, and the report is just a written formalization of what we already knew was happening. And this is happening at every public hospital. What makes this sad is this hospital is where our most vulnerable people go, mothers and children and pregnant mothers. And we called all those points that are being raised in the report. We called out the deficiencies of the CEO. We called out the infrastructural problems. I did my residency in that hospital when it was called Coronation Hospital. Nothing has changed. And I did my residency in the mid-'80s. Nothing has changed. There was no ICU, there was no blood bank back then. So it's not like it's something new. And we've been calling out to Gauteng Department of Health to set things right, and nobody listened. When there were attempts to gag Dr. De Meyer after he publicly went out and mentioned what was wrong, we met with people from the Premier's office and Gauteng Department of Health at Rahima Moosa. And we set a time frame of 3 to 6 months to start putting things right. And we actually mentioned that the CEO had to go, because that was the weakest link right there.
When was that? Prof, when was that?
That was, when did this whole thing happen? When did Dr. De Meyer's letter hit the newspapers? Alex, do you remember? But immediately after the I Am movement started, about 10 days after our letter was published, the Premier's office and the Gauteng Department of Health met with us. So I don't have the exact dates to rattle off to you. We met at Rahima Moosa Hospital and we outlined a time frame. And we said within 3 months, we want this and this and this done. And after 6 months, we want to see at least these minimum things met, and the long-term things would have to be planned for. So what is coming out in the Ombuds report, we already knew.
Yeah, and I stand to be, Prof, I stand to be corrected, but I think we're talking a year ago or over. Prof. van den Heever, perhaps you can come in and tell us if you know that timeline. But let's talk about what Prof. Mathiva is saying, that Gauteng knew about this, and we've spoken about the Gauteng Department of Health before, and of course they will be involved in the response now. I mean, even this, the Health MEC was posed a question about how often the CEO was at work, and she said since 2021, when she started, Mkabayi had spent 346 days at the hospital, but the Ombudsman found that 71 days were unaccounted for. So it seems like there's a discrepancy between what the MEC was saying, what the Ombudsman is saying now. Does that mean this CEO was being protected, or the MEC didn't know what was going on?
Yeah, so firstly, it's all very concerning. I'd say that the De Meyer incident happened in sort of roughly June 2022 and initiated this. And the issue that one has to look at with this facility is when it gets into a state like this, it doesn't happen overnight. It shouldn't have to take an investigation of this nature in order to address the kinds of problems that are being identified. What this indicates is there is no accountability structure that operates within the Gauteng Department of Health. And effectively, this hospital is being permitted to degrade and to be run improperly on a long-term basis without any intervention from the province. And that is a very, very serious issue because it applies to all the facilities in the Gauteng Department of Health. And on the question of whether or not this CEO is being protected, these were political appointments, and this is a real problem. And the Ombud has indicated criteria for a CEO. The first criteria is no political party membership. They must not be appointed because they're political appointments. They have to be professionals who can run a hospital. And that's partly what's missing. The other part is that when a CEO is in place, there must be, that facility, that hospital must be accountable for how they operate. That means report effectively, proper strategic plans, proper engagement with staff and with patients. And the other issue about the population, the catchment population that's affected by this facility, you also have to manage that at a strategic level. It's a spillover problem. It can't be handled at the level of the hospital. The province has to make sure that its strategic investments cope with the demand, or where demand is actually coming from places that are across South Africa's borders. There has to be a strategic framework implemented by the national government. It can't be done by the province alone. Yeah. All of these things are missing and they affect the whole province. But what is shown here and demonstrated very clearly is long-term neglect.
So, Prof, thank you very much. Let me return to Professor Mathiva, and just to, I'm not correct, but I said 72 days earlier. That was just in 1 year that the Ombudsman couldn't account for the CEO in terms of leave that was irregular. So the quality of CEOs is important. Professor van den Heever talking about political appointments. The Progressive Health Forum, I understand, says it can be traced to the shotgun approach taken by a former health minister to replace all hospital CEOs in one mass appointment. Can you talk about that? Do you believe that this issue with the quality of your top official in hospitals is being replicated across the province and possibly in other provinces as well?
So the problem started with the idea that you could just get somebody who had a little bit of business savvy to run a hospital with no clinical environment experience. Then things went wrong when these people who were sought were cadres that were just deployed to hospitals. And they had no experience, and then they were protected. Whenever they made mistakes, these mistakes were hidden. And nobody was held accountable. Some of them were deliberately placed in large institutions because they were manipulatable. so their principals could instruct them to do whatever it is they wanted them to do.
Are you now saying that the health MEC would be responsible? The current health MEC, the former health MEC, can you be more specific?
I am saying that the MEC has no business getting involved in the employment of a hospital CEO, because the MEC is a political appointee. Mm. There should be experts that should be involved in the recruitment and selection of professional people that are able to run a hospital, which is a clinical environment that looks after sick patients. Yes, they should have a bit of business savvy, but they should have a very solid, sound understanding of the health environment.
Are you feeling better now that national government is involved? The health minister said they had to look at the report, but they will be doing everything to fix this institution. And of course, one of the things the Ombudsman has raised is standards of CEOs, minimum standards. I can't believe we're talking about that now, but do you think that some sort of minimum standards will be put in place?
We are very good at drafting good documents, standards, the ideal hospital document, and putting it on paper and never following through. I am not feeling reassured or better that National is involved, because it may end there. You know, I've been there, had promises from National. It's happened at the hospital where I work, where National has come and promised heaven and earth, and up to today, we're still waiting for a follow-through. Mm. So I'm now the kind of jaded public healthcare worker that says I will believe it when it happens. It's unfortunate.
Professor van den Heever, we're running out of time. Do you feel reassured?
Oh, no, not at all. I mean, this report is no surprise. And how would it come as a surprise to the Minister of Health? It would imply that he knows nothing about the health system as it currently operates. He also hasn't implemented any kind of reform that would introduce accountability structures that would impact on outcomes within facilities. So I think that this is really a reaction to a report that has forced this issue into the public domain, whereas it was preferably kept hidden before. So this is, I'm afraid, I don't actually think there will be a lot of action unless we basically as citizens and society and academics and people working within the health system push very, very strongly for new accountability structures to be in place to make sure that we actually have properly run institutions. We don't need a health ombud to tell us this. We do need a health ombud all the time, but they should be dealing with outlier institutions. I'm telling you now, if he investigated every single institution he investigated, he would have a very similar report at this point in time for pretty much most of the public health system.
Yeah, what a scary, sad situation. Like the first prof said, dealing with very vulnerable women and children. Unfortunately, we have to leave it there. I have so many more questions, but that was Professor Rudo Mathiva, progressive. In fact, she represents the I Am movement and also head of critical care at Hani Baragwanath, and also Professor Alex van den Heever, Wits Social Security Systems Admin Management Studies Chair.